you all for your patience as we are getting started. As we know, even this long doing some of our virtual work during COVID-19 and the pandemic, there's still always some technical challenges and difficulties. It's just part of our work life. And I do want to give a disclaimer as well. I have a shared wall to my right here, and my condo mate is having a kitchen remodel today. So there was some drilling earlier. I've asked them to stop, but if there's also drilling or random noises, there's some construction happening next door. So as we do as housing advocates and people in this field, we're always flexible and we're going to make it work. So I'm Debbie Fox. I am the Senior Housing Policy and Practice Specialist here at the National Network to End Domestic Violence. So we're here today to talk about the HUD NOFO, the Notice of Funding Opportunity. And in particular, we really want to think about centering racial equity and being able to implement the work that HUD is really elevating with the new administration and the new folks at HUD is that they really want to increase access to HUD Continuum of Care and homelessness funding for culturally specific communities and organizations. So we're going to be talking about that, sharing some models and ideas that work and have been really innovative across the country. So I have a couple great colleagues with me today who are experts in that arena and doing housing related work and HUD NOFO work in particular. And so I wanted to just go on to the next slide to just give you a little overview of what we're going to cover. So just a quick overview of the DV Housing and TA Consortium. I think a lot of folks already know about our work, but I'll do a quick overview of our consortium work, a little bit of an overview of the critical intersection and who's most impacted by interpersonal violence, sexual assault, human trafficking, and racism and homelessness. And then we're going to learn about some of the best practices and ways to implement HUD programs in culturally specific communities, and then how to build really authentic partnerships and not just relational partnerships, not transactional, but relational partnerships, long-term connections with organizations in communities so people can build partnerships that last and that really make a difference for those who've been most impacted by historical racism and housing inequality. And then we'll also talk about just some of the federal resources and funding opportunities. So next slide, please. So a little bit about the DV Housing TA Consortium. We are a federally funded consortium that is supported by a bunch of different offices at the federal level. So there's the Family Violence Prevention and Services Office, HHS, at HHS that funds a lot of the shelter and housing and services for victims across the country, the Office of Violence Against Women in the Department of Justice, the Office of Victims of Crime at the Department of Justice as well. And then we also work closely with the HUD Office of Homelessness Services, a special needs program. And then the technical assistance providers that I work closely with as a part of the consortium include the National Alliance for Safe Housing Collaborative Solutions. Oh, that's a test. Okay, I was going to say I can remember them all. The organization I'm with, NNADV, the National Resource Center on Domestic Violence, and the National Sexual Violence Resource Center. And I think we can go to the next slide, please. So part of the organization I'm with, I think a lot of folks are familiar with NNADV as we do a lot of policy related work, and we're in the midst of doing a lot of work to pass legislation at the federal level, but we're a social change organization creating a social, political, and economic environment where violence and interpersonal violence no longer exists. So the project I do specifically is around housing and housing supports with a particular focus on federal funding and HUD related funding opportunities. Next slide, please. Oh, this is you, Shafeka. I think we're already
so we're just introducing, yeah, and then Daya will introduce.
You're right, yeah, go for it.
I real quick before I talk about the Georgia Coalition, I see someone's hand going up and down. Is there a question about what NNADV or the consortium are real quick? If you want to put that maybe in the chat, I think it's Daryl. So I'll introduce the Georgia Coalition. So GCADV, the Georgia Coalition Against Domestic Violence, is our state federally recognized coalition. So we advocate on behalf of our Oh gosh, it's some 53, actually it's inching closer towards 60 these days, member programs. But I also want to really emphasize that our member programs are, traditional shelters, but actually a nice chunk of them are grassroots programs. So I myself used to work at one of those grassroots programs that was an immigration and refugee resettlement agency, but is still a member of the Coalition Against Domestic Violence. And so we take really great pride and care in making sure that grassroots small community programs are still seen in the fullest extent as any other large shelter as a program. And so we collaborate, advocate, educate, and empower. I know, of course, all of you guys can read that. And so, it's all about empowering survivors, their programs, educating the public. Of course, like most other coalitions and our great national organization, we work on the policy for the state. And, our goal is to be stopping domestic violence throughout the state, but we really try to make sure that's always in a way that's racially equitable, that's really centralizing marginalized survivors. Do you guys want to introduce yourselves?
Sure. Hello, my name is Rachna Khare. I'm the executive director of Daya. We are a non-residential domestic violence sexual assault agency in Houston, Texas. And our mission is really to support South Asian survivors of domestic, sexual, and family violence with culturally specific services. We were founded 25 years ago. It was a group, a very grassroots group of 7 friends who wanted to make a difference in their community. There was unfortunately, there was a murder-suicide that in the community that led them to really recognize that culturally specific services were needed. We serve about 350 to 400 clients annually, and I'll talk more about it, but we're so grateful to work very closely with our coalition to provide an incredible amount of housing to folks who would otherwise go unhoused.
Thank you so much, Texas and Georgia, for being here, Rachna and Shafeka. I'm really excited to hear about your presentation. I did want to do just a quick overview in terms of just kind of where we are and where the current state of housing and racial equity, what we're looking at, and why it's so important that these resources and funding go directly to communities most impacted. So what we know since the pandemic has started, there's been a real shadow pandemic with survivors being impacted by COVID-19 and the intersection of race and housing, but also we are knowing that some of the health disparities that have just already been there historically in our country are being impacted with communities that are not having access to the same level of healthcare, and that they are also being impacted by higher rates of eviction and housing instability and inability to access resources at the same rate as other populations. So we know that many states and jurisdictions that Black people, African Americans are dying at higher rates, and that research is suggesting that there's just long-term segregation and historical disparities that is a fundamental cause of health disparities, and also the historical impact of racial discrimination in housing. And so we know survivors are definitely impacted by that. And families with kids, and in particular African American women that experience really high rates of eviction. So we're really concerned that we're in the midst of still COVID-19, and there's still the eviction moratorium ceased, and we're seeing high rates of eviction, and we're also seeing high rates of death and illness as it relates to the pandemic and the Delta surge that's happened this summer. And hopefully people are saying there's potentially a peak, but hopefully, some of that will shift as we go into the fall. But yeah, so we're still in the midst of a crisis, even though there's a lot of trying to normalize and get back to normal, but we're needing to address these things as we move forward with the HUD funding and other federal resources that are coming into our communities. Next slide, please. So I think I spoke to a little bit about this, but there's just real challenge, and things are exacerbated and coming to the surface. We are seeing a lot of systems having challenges. that were already there for communities of color, but now that are impacting more folks, and that there's just historical pieces that have made the COVID-19 reality and the housing inequities be even more dire. Next slide, please. So the other thing is just a lot of us are in the field. I'm seeing in the chat box, people are involved doing DV housing, part of coalitions, but we know that homelessness for women and people experiencing domestic violence is a major contributor to their fleeing or attempting to flee. So any plan or CoC plan around funding and NOFA funding needs to address the specific impact of gendered homelessness, and also the impacts for families and women of color. Next slide, please. So this is just a visual, kind of a lot of those things that were talked about in the earlier slides, but there's a lot of intersections, both from the systemic discrimination and barriers in how policy and systems are created, but that also the interpersonal pieces of someone's actively trying to sabotage someone's life or harm them. So you see with survivors, there's employment discrimination, housing discrimination, and then often abusers use those systems to their benefit to further harm the survivors or their partner. So we have multiple layers of, in addition to experiencing homelessness or housing insecurity, survivors are often having someone who's actively trying to harm them and ruin their life. So you have many, many layers of what you're looking at. So when you're developing programs and working with culturally specific agencies and victim service providers, these are the things that they'll be talking about and hoping to address when working with survivors and getting them safe and stably housed. And so I know we're shorter on time because we got a little bit started a little bit later. So I'm going to pass it over to Shafeka, and you can talk a little about your work in Georgia. So thank you so much.
Absolutely. So GCADV, the coalition, actually implemented the HUD CoC funds for rapid rehousing for years and years and years. And so our model was that we implemented it for a long time, but we truly have a kind of bigger vision for what we want housing to be. We want people, we of course want our member programs, which again, I just want to stress, isn't just shelters, but it's these grassroots programs, community-based organizations, to be able to apply and receive and disperse this funding. But in terms of us and housing as a bigger picture, we wanted to also transition to what other community organizations are looking at to address housing, fight evictions, etc. And so in the end, after running this program for years, I've spent the last about 2 years really transitioning the programs into being able to apply to their CoC. So for us, that's the balance of state, independently, and kind of work with them to do that. And we're going to stay on this slide for a bit. And so I'm going to talk about kind of what that meant and what it looked like when we implemented it for them to kind of learn how to also implement it very flexibly and whatnot. So for us, we made sure, first of all, that when we gave out the housing funds, and I really stress this for state coalitions, if you're kind of in the process of giving out those funds, we didn't just give it to large programs that bring in large numbers. But yes, there is a recording, Max, I saw that in the chat. But we made sure that actually 4 out of the 5 programs were incredibly rural. One of them I'd say is like suburban. But the other 4 were massively rural programs. And yeah, that sometimes means that there might be, not always, but less survivors, or that the shelter's capacity and the program capacity is, let's say, only that they can house 5 or 10 people at a time instead of a giant program that can house 40 or 50. But it was super important that we be able to reach all corners of the state. So tiny, tiny, tiny areas of like South Georgia. The mountain towns is a big one that we touched on a lot. We were heavy in like the mountain areas of Georgia. And so making sure that even with program access, you know, when member programs were saying they wanted to be a part of this, that was done really equitably, and not just to kind of the largest programs who, yes, probably and have already had HUD funding, know how to disperse it, et cetera. But it's actually super important, kind of the whole teach a man to fish type of thing, to make sure that everyone got that chance and not just the folks who already had super established housing models. Something we also did was make sure that our model was really flexible. And that was a big thing I stressed to the 5 programs that I oversaw in this funding, was that HUD actually, you know, for all the headache that HUD can sometimes give us, or that we think of when we think of HUD, HUD can actually also be really flexible. And a lot of times regulations can be written in very vague ways, because the fact of the matter is they're just not going to touch every single situation that we see in domestic violence, in homelessness. And so I really wanted to stress to advocates, to their financial officers, and to their executive directors, that being flexible in how you're administering this funding was crucial to supporting the most marginalized survivors. What that means is that, you know, someone might not fit this perfect example of educational services or healthcare, but, you know, I'll give one good example. Is we had a survivor that was pregnant and had no access to any type of phone system or anything. It was very difficult to, and internet, and it was massively difficult to keep in touch with her providers. And, you know, this is a survivor who's in a homeless situation, was in DV, definitely, you know, a socially high risk pregnancy. And so while technically, like, there isn't something that says keeping in touch with your providers is a medical, you know, necessity, we fought to make sure that that's actually part of healthcare. You know, how in the world could a pregnant survivor with no access, you know, in her own apartment, but with limited to no access to speaking to a doctor if God forbid something was happening and whatnot, get to really have medical care? How would they check in on her to schedule those appointments? And so it was just ensuring that type of flexibility. Same thing when it came to employment, same thing when it came to, you know, even food. And I know some folks know this already and some folks don't, and that's okay. We're all kind of on this learning journey together, but making sure that advocates and all of us, you know, didn't have our own biases when it came into, like, HUD allows for food spending, but, oh, that grocery bill was too high and it was all on unhealthy food. At the end of the day, it's talking to survivors and making sure that's actually, you know, what's working best for them. You're working long hours and frozen meals are the best you can do right now, then that's great. And quite frankly, HUD doesn't say go through the 2,000 calories of nutrition and make sure that people are doing exactly what you want them to do, as though we all are following that type of ruling ourselves on our day-to-day lives. And so anyway, the point being, just to really fight for massive amounts of flexibility as much as we possibly can, obviously within the HUD rules, and being able to, you know, talk to our HUD guidance folks, submit the questions if people had concerns, but that we weren't there to implement the rules in the tightest way possible. But in fact, we were there that domestic violence survivors under HUD are given a tremendous amount of flexibility. And so we wanted to do that. Another big part was building the capacity of these programs. So like I said, for years and years and years, we were the administering funding source. But for the last 2 years, you know, we didn't just spring it on people at the last second, hey, we're not going to be funding this anymore, you're going to be applying directly. But we spent 2 years talking, working with folks to get them building their capacity to be able to apply to our balance of state directly. Because for those who don't know, if you're new to the HUD NOFA, you don't apply to HUD directly, you apply to your balance of state, and they're the one, or your CoC, you know, depending on what they're called in your state, and they're the ones who actually then officially apply to HUD. But you have to apply to them and follow their and HUD's rules and whatnot. And then they rank you and that kind of thing. And so we wanted to build their capacity in doing that. So with that, that's, you know, oftentimes we'd have advocates who ask me a question and they just want me to give the kind of yes or no. But instead it was showing them and their financial officers, again, what the actual wording was and getting them comfortable with reading regulations themselves, getting them comfortable with understanding what the grant looked like themselves. So another story I tell is that HUD in its grant questions asks people very specifically to name what they do for oh God, now I'm blanking, of course. And I did this last time. I blanked on this exact same phrase, like harm reduction. Harm reduction practices if you are working with survivors that have substance issues, substance abuse problems. And a program had kind of written up these responses that they clearly actually didn't know what harm reduction meant. It was not a term they were familiar with. And again, when you're working with tiny community-based organizations, the lingo that everyone's speaking isn't always there. This kind of like harm reduction versus what community organizations are always doing, which is not just kicking out folks who might have substance abuse, addiction issues. And so they're already doing these things, but they see the term harm reduction. They're not quite knowing what that means. If that's needle exchange, if that's educational opportunities, if that's, not like judging survivors on practices and whatnot and working with them. And so these programs were kind of answering these questions very poorly. And it's actually going through and being like, okay, so clearly we aren't super sure of what harm reduction is. So let's actually talk about that. Let's educate on that. And let's actually talk about implementing it. Because if we're not super sure about what it is, let me give you examples of ways you're already implementing it and what I've seen over the last few years. And what are other ways you can think of for expanding it? And again, in these ways, you give tiny organizations the biggest chance at success, because at the end of the day, they are fighting against the biggest and still wonderful, none of that is to knock our big, more prominent, like 100-year established shelters, but it's to make sure that they actually have a fighting chance when their applications are getting ranked. 1 second, I'm going back to my slides now. I apologize, now my computer is freezing on me. There we go. Nope. Okay. So yeah, as I mentioned, doing this for community-based organizations was, vitally crucial, and making sure that they got a seat at the table. And for us, that starts, not to sound like a broken record, but just even making them equal footing member programs, which I just want to stress, it's not like GCADV is perfect. That wasn't the way it was for a while with our community organizations. They were kind of tiered differently from, state certified shelters, but now it's making sure that they get those same types of opportunities. So and you can next slide, we view CBOs, community-based organizations, as a very crucial and necessary bridge of communication and connection to the most marginalized survivors. So I think about my time working at an immigration and refugee resettlement agency, which was, we didn't technically have an established shelter, but we're giving out housing funds, through our state programs, through our state funded agencies and all of that. And so it's making sure that they also know what kind of things are going on and that these opportunities are available to them. It's really also understanding that, I speak a lot about this immigration agency I worked at, that they're already often doing so much domestic violence work that's not counted. They don't have the statistical report for it and the things that these other programs have. And so it's actually sitting down with programs and getting to be like, okay, so this person holds weekly meetings in their living room with 10 survivors, and you all will have an advocate who attends, whatnot. And they're not counting this as anything. And I'm like, that's an educational session. That's a community session. That's, things where you're learning about the survivors and building trust. All of these are countable skills and countable items that when you're asked in a grant what type of work you're doing, this is it. Whereas typically I'd see this all the time with CBOs. They'd be like, oh, well, we're not doing that. We don't do these things. I'm like, what are you talking about? Of course you are. There we go. And next slide, sorry about that. And so, we wanted people to know how to best maximize what their opportunities are. So we don't keep CBO separate, right? We want the local programs, the local shelter programs, to know who their local community programs are and vice versa. We want them to see that they are kind of integral to one another as opposed to just in competition with one another. And that's really hard to do when we kind of live in these models that like everyone's competing against funding. But we wanted shelters to see, look, these community-based organizations, oftentimes survivors are talking to them more than they're talking to these advocates, because there's just a different level of trust. There's a different level of like people hosting things in their own living rooms, in their own homes, but vice versa. Community-based organizations were often like, listen, I can't house someone for, 6 months, for 9 months. And so they also really did need to know what types of resources shelters were offering. And at the end of the day, just because of the way things get structured, shelters are often getting more funding than tiny organizations, just because they have larger amounts of staff, larger amounts of survivors they might be able to reach kind of on paper. And so we wanted to make sure, though, that they actually worked hand in hand with one another. They saw each other as crucial to their success. And then with that being said, it's, like, this is very obvious. This is what we're all here for, identifying the funding opportunities that work for them. Right now, we're talking about this, like this HUD NOFO. I'm getting a habit of saying NOFO instead of NOFA, which is what it was. Another big thing with our community-based organizations is making sure that they're there when we're talking about systems activities. And I think the systems conversations can be more dull often for people about like, what statistical system are we using? People might be sick of the word like VISPADAT. What data tracking mechanisms are out there? What's going on? But community-based organizations, if you actually talk with people and are honest and tell them, this is what's going on with this system, they know inherently just as much as any other program, well, that's flawed because that doesn't count these types of people. Oh, well, that doesn't seem to make a lot of sense to me. And it's making sure that they're at the table, not as like some special advisory board later down the line, when all the decisions have actually been made, but that they're actually at the table when these conversations about the systems, the things your state is doing, maybe if it's about the state is changing the way the grant gets dispersed, whatever it is, that we as coalition staff are making sure that the community-based programs are getting the chance to be there in that same moment. And I will be honest, some of that includes greater education on our part as coalition members, because, you have to start a little bit more from scratch than you do with like an established shelter with an executive director who might have been there for 15 years. You're starting explaining these things from the beginning, but I think that that's our role in making sure we're actually touching the most marginalized and in genuinely building the best relationships between these community organizations and our more traditional shelter programs. So that's it for me. I'll turn it to Daya.
Hello, give me 1 second. I am just going to, there we go. Okay. Thank you so much for having me. My name again is Rachna Khare. I'm the executive director of Daya. We're located in Houston, Texas, and we serve primarily the South Asian community, but I will say about 75% to 80% of our clients are South Asian, and the rest come from other similar immigrant groups. So we see quite a few Middle Eastern survivors, folks who are East Asian, North African. So we're seeing lots of intersections between the different cultures. What I'm going to be talking about today is who we are, really building up on, again, what was already presented on the role of culturally specific organizations, some of the challenges that we face, and then we'll talk about a case study, which is really just our housing program, and then, of course, how and why to partner. And I hope that case study will help inspire y'all to take some risks in partnering with each other. So just a little bit about us. Daya was started, as I mentioned, in response to a tragedy that happened in Sugar Land, Texas, right outside of Houston. There was a group of South Asian women who wanted very badly to give back to their community, and they really thought of assimilation and like how hard it was to come from another country when you were already kind of like in your late 20s and your 30s and start over. And so they knew that what they wanted to do was help women make that transition, whether they were stay-at-home moms or wives or working or not working. And then as they were kind of putting this strategy together on what to do, there was a murder-suicide where a 28-year-old recent immigrant and her 3 children were killed in a domestic violence incident. She lived, not even 10 minutes away from a local shelter. She spoke English, she was working, she was, she had friends. And so what dawned on our group of founders 25 years ago was clearly, there are barriers that need to be addressed, and there is such a need for culturally specific agencies and services for the different communities that make up many diversities like Houston. So our mission, again, is to empower South Asian survivors, and we do that through direct services, but we also do community education, prevention work with youth. We're in faith-based institutes, as well as cultural centers, to really try to meet the community where they are. Our services are culturally specific and trauma-informed. I think it's really important, and those of you have seen in the chat that some folks are from culturally specific organizations. Sometimes things can get a little unwieldy, right? Like if you have a group of volunteers and they're helping, and people can get over involved, boundaries are not followed. It can get, danger can actually rise. We've had culturally specific organizations that are, they haven't done the training or they're not trauma informed. And a lot of times they'll say, you know what, we're gonna just talk to your spouse. We're gonna talk to your husband. We'll go to your house. And of course, as anyone anyone on the call who is working in the domestic violence field knows, that a lot of times when people make that first call, they're doing so confidentially, and they're doing so without their abuser knowing. And that's incredibly important to their safety. And so I think what we do really well, and what culturally specific organizations that also engage within mainstream systems, and especially mainstream trainings, what we do really well is strike that balance between being culturally specific, understanding the needs, understanding the community, but also holding those values and ethics of domestic violence work, and especially confidentiality, very, very closely. Our team, our family is a small but mighty team. We're a team of 9 and growing. And again, we serve about 400 clients every year. So a little bit about our services very quickly. And this, I think, is what was mentioned before. This is what so many culturally specific organizations are doing. We're doing holistic case management. It's helping people fill out forms and navigate systems. And this is all, new to folks. And so really holding their hand while they go through the process. We provide mental health services. So we have 4 licensed counselors on staff. Safety planning. And a lot of our safety planning happens before the client is, while the client is still in that pre-contemplative phase, right? They're still deciding, do I want to leave? The cultural stigma to leaving is so strong. I'll talk about that in a second, that many times the safety planning services we do go on for a few years before somebody is able to leave the home. And actually, I see that as a success in a way, because we know that we're not another controlling force in someone's life, that we're just helping them stay safe until they know that it is safe for them to go. And we always believe in trusting a client's instinct, and we tell the clients that as well. You are the expert of your situation. How can we help you get to a safer place, and on what timeline? Systems advocacy, as I mentioned, really going to bat for uplifting the realities of what challenges our community faces, and really not just our community, not just the South Asian community, the overall immigrant community, people of color in general. We also have quite a few African-American Black survivors, and that is quite frankly because they say to us, oh, I've gotten the best services here. You all really understand my story and what I need, right? And so what we do with that information is we make sure it doesn't sit in this silo of our organization. We take it out to our mainstream partners. We say, hey, this is what we're hearing. This is what survivors are experiencing. And this is where, as a movement, we might be failing them. And so, again, it's really about what Debbie was mentioning, relationships and being truly friends and partners with the other agencies in our region, because we very openly talk about what the barriers are, what bad experiences clients have had with our agencies, all of our agencies, and how we can prevent that from happening again. So it's a very vulnerable place that we are with our partners and them with us. And it works out really well because we start to make some big changes. Of course, I'm here today because we provide housing. I'll talk about our housing program, but we've done housing for quite some time. I think 20 of the 25 years that we've been in Houston and been an organization. However, we didn't necessarily see it as a quote unquote housing program, right? We saw it as, oh, this person just needs rent paid this month. It was bridging the gap or filling the gap in our community. And so, doing that housing work, helping people with housing advocacy as well. Legal consultations, this kind of works just like housing. Many times, the clients that we're serving fall through the cracks of mainstream systems. There are a variety of reasons, which I'll go through in a second, but many times they need that legal support. And so we really do, we have a very strong legal clinic of pro bono attorneys that can provide services and even represent some of our clients who may not be eligible for a myriad of reasons for some of the pro bono legal agencies, which we also, of course, partner with very, very closely and appreciate so deeply. Then there's financial assistance. I laugh when we've seen throughout COVID, what's been amazing is that so many groups are now providing like flexible financial assistance and direct cash assistance to survivors and mutual aid. We've seen it, I'm sure we've all seen it happening. And the beauty of it is when we started getting some of these COVID funds to give straight out to survivors, we knew how to do it already because we were like, oh, this is what flexible financial assistance is. It is the fact that, somebody needs, $500 to fix their car, or they need $400 to, pay a security deposit, and we just give them the money. We had been doing that for quite some time. And so to be able to name it and see it and see the success of those strategies uplifted in mainstream communities has been really exciting. And then multilingual support, honestly, it is so powerful to be able to tell your story in your language. I know we have a diverse group here. So many of us speak so many different languages, come from so many different backgrounds. And we all know that the reality is some of our languages don't even have words for abuse. That I remember translating a video once that we made the video in English first, and we were translating it to Hindi, and I stopped and I said, okay, I know how to say hit or yell or slap or push. Like I can say all these words in Hindi, but the overarching term of intimate partner violence, I didn't have it, And so that's one of the things that's really special about multilingual support is that it's not just a straight translation, a straight interpretation. It is actually understanding somebody's story using the language that they use. So the role of culturally specific organizations in the mainstream system, I think up at the top, really addressing bias and privilege, understanding, right, where somebody is coming from. It is comforting, right, to walk into a space where you feel like, okay, this person understands my culture. This person understands my barriers. I don't have to make excuses. I don't have to over-explain myself. So really, and it's on us. It's on our team to do the deep dive and learning into the ongoing work on understanding bias and privilege, so that we can better serve our community, because this bias and privilege happens within the community as well, right? I mean, I think anyone who is South Asian who might be on the call knows, and others too, knows about caste bias and colorism and discrimination against religious minorities within the South Asian subcontinent. And so these are all things that that carry over, right? Even as you live here in the United States, and it's important that culturally specific organizations address those issues that come from the home country. Being an expert in and of the community. So it's being that bridge, right? We understand the community themselves, they see us as the experts, so they're coming to us, that trust is there. And then the mainstream systems are seeing us as the expert of the community. So they're learning from us, they're getting trainings from us, and vice versa, you know, with us as well. And then filling the gaps. You know, our goal is really just to ensure that people aren't falling through the cracks. I mean, just like all of y'all on this call today, it's incredibly important that we, you know, we're well, our movement is funded, you know, more so than survivors themselves. We have more access to resources and funding than survivors do without us. And so it is incredibly important that we commit to not letting folks fall through the cracks. I see a hand up. Because I'm sharing the screen, I can't see the chat, but if somebody wants to unmute and I can answer the question, or the question can go in the chat, either way, I'm happy to be interrupted, by the way. I actually like that. So if someone has a question, please jump on in. Okay. Let's see. So expert of the community. So some of the challenges that the South Asian community faces, and this is going to be similar for many cultural communities, many communities of color. The first, obviously, most obvious one that people think of is language, and you know that is true. And I talked a little bit about that. And it isn't, of course, just understanding what someone's saying, but it's like actually hearing them, right? Finances is a big one. A lot of survivors are professionals in their home country, and they come here, and you know, this ties into immigration abuse. They may not have work authorization to work here. Financial abuse is incredibly prevalent across all communities, but I will say, because of the inability to work for many immigrant survivors, it becomes another thing that becomes an even bigger barrier if you are relying on your spouse to complete your visa paperwork. And if they don't do that as a tool of abuse and control, you're not able to make money. In many cases, our clients may be working. They may be forced to work in their in-laws' business, their family businesses, but they're not getting paid, or the paycheck goes straight to the abuser. And so those are some of the unique ways that financial abuse can show up in cultural spaces. Isolation, of course, we all know that this is a goal of abusers, all abusers, to isolate survivors. But I will say, when your family is across the country or across the world, the isolation becomes stronger. And then, you know, we also see religious abuse that happens both ways. We have abusers that use religious text as a reason for the abuse, and then we have abusers who do not let the survivor, or do not let their partner practice the religion in the way that they want to, or communicate with or build social systems within their faith-based community. Lack of trust in mainstream systems, that of course comes from the home country, and it comes from here, you know, and this is one of those barriers that I will say is not at all specific to the South Asian community. If anything, I would think this lack of trust in mainstream systems is probably most prevalent for our African-American and Black brothers and sisters who are experiencing violence, because it is a risk, right, to interact with the legal system and law enforcement. And that's honestly just the reality. I talked a little bit about immigration abuse. Another thing I wanted to mention here is that many times the abuser purposely leaves their partner undocumented. And with that comes the, then they have children here in the United States. And when the abuse is happening and the survivor may say like, hey, I want out of this relationship, the abuser will mock them. They'll say, go ahead, call the police. I'll have you deported and you will not get to take your child with you. And that is the reality. I mean, there is immigration relief out there. There's VAWA, but that's, really if you're married to an American citizen. There's a U visa. That's only if you file a police report. And even then it's few and far between. So immigration abuse is a major barrier. In-law abuse is something very, very common. I would say 90% of our clients have multiple perpetrators, not just their spouse or partner, but mother-in-law, father-in-law, brother and sister-in-laws. All of that comes into play. And in that way, many times they are watched and monitored constantly. And then lastly, transnational abandonment, which is a trend that we've seen for many years. We've been trying to educate judges and attorneys about this trend where the abuser will take wife and child on a trip to the home country, and then he may say, oh, okay, you stay an extra week. I'm going to head back with our child so they can start school. But with that, he cancels the return ticket. He takes a passport, and then when he gets back to the U.S., he files for divorce and he says it's abandonment. And we've seen many, many clients lose any substantial access to their children because of transnational abandonment. It's not rare. I remember learning about this for the first time years ago and thinking, oh, that's so tricky. And apparently, what I've seen over the years is that it isn't. It's actually quite normal, unfortunately. So those are some of the barriers. I wanted to talk a bit about our housing program, just doing a time check. And again, as I mentioned, we had been doing housing for quite some time. Even back in the late 90s, we were providing rental assistance. But in 2014, we purchased a transitional home, in 2009, we purchased a transitional home. And what we learned, like many of you on this call, was that it is re-traumatizing for folks to move into shelter, move into a transitional home, and then have to move out of that space. It's just, it's that constant kind of transient nature of it that becomes re-traumatizing. So we sold the transitional home in 2014. And with that, we had a bulk of funding from the home that we sold. And we used that for rental assistance, and it was completely flexible. People could ask for 1 month, they could ask for 3, they could ask for 6. It was donor supported, because the transitional home was purchased through a capital campaign from our community. And then when it was sold, those funds went to the same thing. And we tried, and I'll talk about this in a little bit, but we tried to continuously raise money from our community for housing assistance. But it wasn't too successful until later, and I'll tell you about that in just a minute. The challenge of our supportive housing program is, while it was so flexible, there was those of you who live in Texas know real estate. It wasn't a huge amount of money, and therefore it was pretty short term in terms of how much rental assistance we could provide. We had never provided, before we started working with our coalition, we had never provided more than 9 months of rental assistance. And we were proud of the 9 months. We thought like, that's a great amount. But as we really started to see the intersections of abuse, we quickly realized that the 9 months is kind of the bare minimum that people need outside of an emergency situation, which of course all of you have seen more of during COVID. But that was our housing program, our internal housing program, donor supported, community backed housing program. And we still have it today. And I'll tell you how we sustained it. So then in 2016, something magical happened, and it was actually my second day of work. And Barbie Brashear, who is the executive director of the Harris County Domestic Violence Coordinating Council, called me and said, welcome, to this movement. And do you want to be a subcontract for rapid rehousing with us? I said, what is rapid rehousing? And so with that, a beautiful relationship was born as she reached out to us. I think that is so important for mainstream agencies and coalitions to know. I would have never in a million years known that this was like an option for us. We are still a subcontract to the Harris County Domestic Violence Coordinating Council. This is where we can provide 12 or more months of rental assistance. It's glorious. It has been life-changing for clients in our community, life-changing. Some of the downfalls, of course, there's more administrative work. There's a lot of data. And it's also like, it feels kind of scary. We're a smaller agency and we're like, don't want to make a mistake. We don't want to, ruin our chances of future funding. We don't want to make, we don't want to make our funders upset with us. It is intimidating. That's the word I'm looking for. And then the other thing is that some of the unique challenges faced in our community, and really in immigrant communities and communities of color, were not always reflected in the housing assessment, in the uniform housing assessment that we use in Houston. And so that was a challenge at the beginning, which we addressed because our partnerships are just amazing. But again, we were able to have this, the power, the power that we can give a client by saying, here's your 12-month lease. You don't have to worry about rent for a year. It is incredibly powerful, both for our advocates and our clients. When we were doing our supportive housing, it was, you'd get 3 months approval and then you kind of have to ask again, and is there money? It was not coming from a place of abundance the way that rapid rehousing is for us. What we did to address some of the challenges that I talked about here is we have regular trainings with our NTA and support, not only from the coordinating council, not only from our coalition, but from our data managers as well. We have contracted employees from the coalition to help us, right? Like go over our files before we have an audit and really just train our staff and help us enter data and help us, really do this correctly from the get-go. Because it is a lot, I will say it's still a lot. And it's still a lot more than we had ever done. It's still the grant that requires the most kind of paperwork and double checking and triple checking, but it is absolutely worth it. I will say we have incredible patience from our funders and from our data specialists. My goodness, the amount of texts and emails that we sent at the beginning saying like, what's this? And how do you enter that? And what does this mean? And, what is literally homeless versus, the HUD definition? We had a million questions. And so the patience that we received from our friends at the coordinating council, as well as the data folks who are helping us, has been instrumental. We could not have done it without them. And then as a team, knowing our boundaries and our limits. Some examples of that is there has been opportunities for us to maybe apply for more funding or maybe apply in a different way. And there are times that we have been able to take that on, and that's been really exciting. But there are times that we step back and we say, oh, okay, if we had to do this kind of program all on our own, with just 2 administrative people on our staff, me being one of them, can we do it right? And so understanding when to say no also has been helpful. Although I will say, we very much adopted an abundance mindset to this partnership and a say yes approach. And we really trusted that our coalition would walk with us through this journey, and they really, really have. And then of course, when we combine these approaches, right? So we have rapid rehousing, and those are for folks who meet that definition, right? They're homeless, they're fleeing an abusive home, they're living in a shelter. But then earlier, as I told you, we work with clients who who are not ready to flee, right? Or maybe they fled a long time ago, but they're still waiting for their work authorization and they need money to pay the rent. We are able to decipher which clients fit best in which programs, and we are able to serve more families, not just because we have more money, but because we're able to leverage it really well, right? So there may be some clients who are like, we know that their immigration case is going to take 28 months. We may know that from the get-go. And we can say, okay, let's get them in rapid rehousing. And then when that assistance ends, then we can fill in with our supportive housing. And so we make that plan, alongside clients, and it's able to really take every dollar farther. And yeah, that's what I'm sorry. And I skipped to my second bullet point, but providing longer assistance to the most vulnerable clients. And when I think of most vulnerable, I think of folks who are undocumented, limited English proficiency, facing disabilities, and or with children with disabilities. And we have been able to support clients in this situation for a long time, for up to 3 years at sometimes, and until when, of course, we can get some access to Section 8 vouchers or permanent supportive housing. That's always a wonderful thing. But until then, as we're working through that process, people have the immediate need. It is quite a crisis. And then providing additional support through the community. So I told you earlier that we used to try to fundraise and say like, hey, can we, we're building our housing program and donate this much. It really didn't land. And until we said, oh, we have this, we have $250,000 a year in rental assistance. Add to that. So having that bigger number made people feel like their donation was doing more because it was going to this bigger pot of money, right? And so it really did bring in more community donations as well. And we told the community things like, okay, rapid rehousing pays for rent and utilities, but it may not pay for, it doesn't pay for furniture. It doesn't pay for childcare. There was a lot of things, a lot of gaps that we needed to fill, especially the furniture one it's always a huge one. And so we see that our community comes in and says like, okay, this person has a whole year of housing and you need, $500 for them to furnish the apartment with a bed and some cribs and, a couch, done, right? And so it's much easier to get those needs filled because our community is like really proud of us that we have this federal funding for such long-term rental assistance that they are happy to then donate because they then see the sustainability in it. So just to close out, I wanted to talk about, if you're a culturally specific organization, I saw some in the chat, why partner with mainstream agencies? Of course, the obvious one is that there's access to larger funding streams. But it's not just that. There is administrative support. I have learned so much about federal grants in general. I have learned, I've gained more confidence in then seeking out other sources of funding too. And it has been just a tremendous gift to our organization, really life-changing. Housing navigation support has been incredible. Our coalition, man, they know everybody. They know so many landlords, and what they do is they introduce us to those folks, and then we're able to know them too. So even when we're working in our supportive housing program, we go to these landlords because we know them, they know us, we trust them, they trust us, and it works out really well. We learned a lot. We learned so many best practices and we were able to implement them because we had to. We knew before we had federal funding, we were like, this could be better. This documentation could be better. This, all these things that we should be doing better. But this kind of lit the fire under our feet to say, okay, it's time, step up to the game. And it really built our accountability. And then of course, a safer community, which is what we're all hoping for. And then if you are a mainstream organization or a coalition or a council, a city council, why partner with culturally specific agencies? I just told you that our coalition has to answer my emails all the time and take my text messages and help me constantly. And so why even do it, right? And what I will say is I hope my friends at the coalition would agree, is that what we bring from Daya is providing a new lens on traditional systems. When I talked about that housing assessment, it didn't include immigration abuse. It didn't include in-law abuse. And as we started, when we were at that table, we were like, oh, the reason our clients aren't scoring, as high is because there's all these vulnerabilities that are like nowhere on this assessment. And they said, okay, let's add them. And what ended up happening is not only did that tell a more accurate picture of South Asian survivors, but it told a more accurate picture of Hispanic, Latinx survivors, and of African-American survivors, and of East Asian survivors, and of Middle Eastern survivors. It really started to, these assessments now reflect the community that we are a part of, the Houston community. And, and with that, we're all of the agencies have benefited from having a more culturally competent assessment. And then it's a great way to do advocacy for immigrant groups. You're making sure, of course, survivors do not fall through the cracks. You're reaching other community-based organizations. I have introduced introduced so many of my, some of the culturally specific organizations that we work with. I've introduced them to the coalition. I've said, come with me to a meeting, and that has just made the safety net for our community. It makes it stronger. We're all woven into that, and we just make that net stronger the more of us who are at the table. And then some of the things I just wanted to highlight is some emerging issues that we're seeing. Obviously, the continued impact of the pandemic, I think across the world, we are seeing that this is not ending. I'm in Texas, so it is really not ending. There is a lot of vaccine hesitation. There is a lot of, there's a lot of places that masks are discouraged, and so the pandemic continues. And with that, the increase in domestic violence and vulnerabilities for people getting sick, and the need for affordable housing. Natural disasters, again, I'm in Texas, I'm in Houston. And so we have everything from summer floods to winter freezes where folks lose their entire homes. They are without power, without water, without food for weeks at a time. This is not ending either. These are the intersections that we can no longer kind of live in a silo where the work we do is gender justice. Economic or environmental justice is a part of our work as well, because these are the disasters that increase the need. And there is increased housing instability in our community. And one of the most recent, this little box just got added on my slides, is the various global crises that are going on. We have seen an influx of Afghan refugees, and Afghanistan is part of South Asia. It's one of the 10 countries that are considered part of South Asia. So we have worked with the Afghan community for a long time. We knew with refugees coming over, with what was happening in Afghanistan, we knew that we would see an influx. What we didn't know is that it would happen this quickly. We thought perhaps people would come over as a family unit, and then maybe 8 months to a year, people might feel comfortable seeking out help for domestic violence, because it does take so long to break that stigma. However, we've seen it already. We've seen people who said, have called and said, I'm in DC, I'm being sent to Houston, my husband will kill me. We've had clients that we have not even met yet that are receiving death threats. And this is not at all unique to the Afghan community. Death threats by the abuser who holds the power in a relationship is the name. That's how domestic violence works. And so this is not unique to the Middle Eastern community or the South Asian community or the Muslim community. But what we're seeing is that as folks are coming over as refugees with limited resources, that the need is much stronger. There just isn't, they don't have a support system. They're completely new here, right? And so with that, the need for culturally specific organizations rises as well. I'm just going to leave you all with a quote from one of our clients. I'll read it just in case there's anyone who has visual impairment on our call today, but you all can read along with me. She said, "Getting rental assistance has been one of the most important parts of my life, and it was a turning point. When I first held my keys, I cried tears of joy. It was life-saving. The kids were so excited to be able to say they finally had their own place. To this day, my youngest son, who is 8 years old, has the exact date and time memorized for when we first moved into our apartment. If Daya," and with that, she says Daya, I say rapid rehousing, "had not helped me and my family with housing, I have no idea how my life would have turned out." And this is a client who lived shelter to shelter. She was in some shelters, and she's Muslim and couldn't, she doesn't eat pork. She had some shelters that said, "Sorry, this is what's on the menu today." Luckily, our domestic violence shelter partners, are wonderful in the different options that they provide. But she was between, kind of mainstream homeless shelters as well. Her experience was devastating, and now she is thriving. She's on her way to home ownership now, which is incredible, and it could not have been done without our rapid rehousing program. Truly, it couldn't have. Our community-based program would not have been enough. And so with that, I am done. And I know we started a little bit late, but I've left us about 15 minutes for, really for questions. I wasn't able to see the chat. And we can just jump into questions if we want to. Does that sound good?
Yeah, do you want me to just read? There's a couple questions in the chat box. So there was one around prevention work with community-based organizations and culturally specific organizations. The HUD funding doesn't specifically, that's not something that it funds. It's not doing prevention work. It's the outcomes are all related to housing and employment and increasing income. But if you want to speak, if you are doing prevention work or what that looks like, yeah, go for it.
Yeah, we are. I personally am very committed to prevention work because I would just love, I know everyone says like, oh, we would love if we could go out of business. I don't want to go out of business. What I want to do is be a primarily prevention organization. We all wish we could solve domestic violence, but what I think will always be needed is this conversation around healthy relationships. Nobody talks about sex or marriage or divorce in our community in any kind of big way. And so the prevention work is done through some of our other funding, through our Health and Human Services grant, through our VOCA grant, and then nice investments from local foundations that really love some of the work that we're doing with faith-based youth groups in the Hindu community, the Sikh community, the Muslim community, and South Asian Christian community. And so we build out different programs to reach the youth, and really with the focus being, what does a healthy relationship look like? Because yeah, we're not explicitly told that very openly, unfortunately.
Shafeka, do you have anything to add around any prevention work that y'all might be doing in Georgia?
Yeah, so our culturally specific organizations do actually a tremendous amount of prevention work. And I would say one of the strongest aspects of that is economic support work. And so what I mean by that is programs that are actually doing work around survivors, mostly women, but survivors in general, being kind of their new heads of household. And so what do like job opportunities look like? What do flexible things look like? If anyone's ever kind of seen, so I do our economic justice work, and now that encompasses housing, but I kind of have transitioned out of just the housing realm. but it's also supporting people, especially immigrants and refugees, in achieving entrepreneurship and getting out of this model of like, no, get the first job. Often it's at a factory and that's it. But it's also like, it's economic support around if you feel good about the work you're doing and it's sustainable and it actually meets the several needs you might have, which is maybe taking care of your old mom, taking care of all your kids, doing X, Y, and Z, then we want to support survivors in actually doing those things. Even if it's not the absolute easiest of like, get a job that's, $12 an hour or whatever at Walmart. And I see that very much as prevention work, because if people feel economically supported and, economically happy, it doesn't even necessarily mean that they're making like this grandiose income that they were even going to be making at like some factory job or whatever it is. So that would have been the case. It means that they feel that they actually have the confidence to economically support themselves, which we know is a big reason people enter into and stay in domestically violent relationships.
And I saw Daryl's question, which is such a great question. Kind of what is that balance between assisting folks and then also building, helping survivors reclaim and rebuild their independence and really focusing on empowering folks. And yes, we we also have like a fantastic, I love it, our economic justice program. It just makes me so happy. One of the things that is very common in our community is that many of the clients that we work with, they have these like incredible talents. They can bake, they can cook, they can sew, they can tailor, like they can do makeup and eyebrows and eyelashes and hair. I mean, really, really talented. And what they have been told throughout their whole relationship is like, these aren't talents. These are just like useless things you do. Oh, all you can do is this, or all you're good for is cooking. And so we worked with an organization out of LA called Free From, which is such a cool organization. They just do economic justice for survivors. Like that's their cup of tea. And what we started to do was we helped our clients build small business plans. So yeah, they had the $12 an hour job at Walmart or whatnot. And so, but in the other times when they're working with us, it was about dreaming really big. Like if you could do anything, what would it be? And we actually have helped some clients develop business plans. And then we work with a nonprofit small business lender called Bayou City Microfund. And they're also a South Asian based organization. And they commit every year to multiple $10,000 no interest loans for businesses for our clients. And so we have had clients start catering businesses, eyelash studios, clothing lines, sewing masks during COVID. It has been incredible to see. We had one start like a farm. I mean, it's been really cool to see. But the other piece of that is I understand, obviously, not everyone can do that. That actually works a little bit better if people don't have many children to take care of, don't have disabilities, those types of things. And with others, what we are always doing is providing that education. I mean, we're having an event tonight about financial abuse for our clients. It's open to the public, but it is geared at our clients, right? And so it is absolutely, and not just financially, but when we think about empowerment, it's also about that mental health piece. We have unlimited free licensed counseling for our clients. We don't cap off at a number of sessions because we want to make sure that they can they can unlearn patterns, they can relearn their love for themselves and rebuild that autonomy. And so empowerment is at the core of what we do. And what we've learned is that when we take care of the rental assistance, like suddenly, because of the hierarchy of needs, right? Suddenly this big weight is off their shoulders, and what can be achieved is really astounding once that piece is no longer on the chopping block.
I do want people to think of rapid rehousing, as something that, of course, in its name, And in terms of what it is, it's not a prevention grant, but rapid rehousing isn't just rental support. And I think that's often severely overlooked, is how many other things are funded by these rapid rehousing grants. It very literally has portions in there on education, employment, healthcare. I mean, supporting people with their healthcare needs has been massively helpful in them actually increasing their employment, because they were finally able to get that PT that was necessary, like physical therapy. It even pays for dentistry, like people who have had horrible, teeth problems, which for those who don't know, can actually then go and affect the heart, can affect so much more. So I do want people to also think when they're applying or receiving rapid rehousing grants that, of course, like the biggest chunk, the largest amount is in rental support, but think of these other services as longer term prevention for the future as well, and for staying out and not feeling the economic necessity or physical necessity to return to DV relationships. Before I see we only have a few more minutes left, do folks have any other questions on like CBOs, rapid rehousing, anything else the two of us have kind of touched on today?
Well, I don't see any more questions in the chat box right now. If anybody wants to add anything else, please do so. But I do want to echo what everyone is saying in the chat box. There's a lot of just kudos to your work and all the amazing things that you're doing. And yeah, both Shafeka and Rachna, like what you were doing has just been an inspiration to me. And I always love just hearing the way that you're framing the work, and then also just making it happen and getting resources to survivors and organizing work and thinking about the bigger picture and how a lot of things are interconnected. As we know, survivors, and especially survivors of color, have multi-issue lives. And so it's not a single issue. It's not just domestic or interpersonal violence. There's layers of what's happening interpersonally, but also, the time that we're in and, the histories of our country, but just there's just multiple issues and layers that survivors are working on.
Yeah, absolutely. And for, folks want to learn more about kind of what types of things you can get from rapid rehousing, if you're here from a state coalition, I'd be happy to chat about, if you're starting getting that funding or if you're transitioning your programs to getting it themselves. I know Rachna definitely would be happy to answer questions. So feel free to reach out to us, and our contact info is at the end of that slideshow that you're all going to be getting.
Anything else, Rachna, before we close out? We'll get the slide deck that, contact information is there.
Oh, great. No, I will just say that if you are a small community-based organization, if you are thinking about, oh, should I do this? It feels really big. And I know I say this all the time. Debbie's probably very used to me saying this. I say go for it. I always, this is a good challenge to take on. It has been instrumental for our organization. I don't even know how we would have addressed. I don't know how we would have done the pandemic if not for not only our rapid rehousing grant, but the relationship, the deep relationship we now have with our coalition and our coalition partners. I just don't know how we would have done it. And so I would encourage everyone that even if your organization is extremely specific to a certain community, that keep that identity, but you as a leader, a staff member of your organization, to spread your wings and really see what's possible, because it's really amazing what we can do together.
All right, I'm good. I think on that note, we can give you 2 minutes back in your day. We'll send out all the slides and the recording, and you can share it with your colleagues as well if you want to pass it along. And then, good luck if you're applying for the HUD NOFO, and there's about $100 million. So there's quite a bit of money for the DVSA HT bonus funds. And then if not this year, there's other years too. So, you know, thinking about timing and just capacity, but I'll leave with what your last words, Rachna, just like, go for it. Why not? Make it happen, and don't do it alone. Have lots of partners to help you along the way. So thank you both so much for presenting, and thank you for all your amazing work. And yeah, thank you.
Thank you for having us.
Yeah, thanks everyone for attending. Take care.